Fellow Kenyans, welcome to the daily updates. On the current status of the coronavirus disease outbreak in Kenya. In the last 24 hours, a total of 81 samples from suspected cases of the disease have been analyzed in our various laboratories. Out of the 81 samples, we have received confirmation of 7 people who have tested positive for the coronavirus disease. They include 4 Kenyans, 2 Congolese nationals, and 1 Chinese national. 3 are female and 4 males. This now brings to 38 the number of those who have tested positive for the virus in Kenya. Out of the 7, 4 had a history of travel from countries with active transmission. 1 had traveled to Mombasa, or 2 did not actually have a travel history but come from contacts. On a more positive note, I'm pleased to note that our first patient, together with the 3rd patient, have tested negative in their first retesting. A repeat test is scheduled in the next 48 hours. We remain hopeful that the repeat test will be negative, confirming full recovery to allow for their discharge from our treatment center. The 2nd patient turned negative, as we already announced to you, and was discharged from our hospital. All the 7 confirmed cases are from Nairobi County. This now puts Nairobi County as leading with 28 cases of those who have so far turned positive. Kilifi with 6, Mombasa with 2, while Kajiado and Kwale have 1 each. Out of the 38 cases, 21 are male, while 16 are female. Tracing of contacts for the 38 confirmed cases is ongoing. The total number of close contacts that we have so far been monitoring stands at 1,141. Out of this number, 163 have been discharged after completing the mandatory 14-day follow-up period. Currently, our teams are monitoring 978 close contacts. We have 3 individuals who have been admitted at Bagathi Hospital awaiting test results. To date, we have now tested 833 persons for the disease. As we informed you, from tomorrow, we shall embark on a mass testing for those persons who arrived in the country last week and are currently under mandatory quarantine. This will be done in line with the World Health Organization guidelines on testing for the virus. Due to the seriousness of the coronavirus disease and its potential strain on our healthcare resources, it has been deemed necessary for the government to institute mandatory quarantine for all those who have tested positive and their contacts. Once you have been identified as a contact to a patient who has tested positive, the Ministry of Health shall send its officials to your house to escort you to a quarantine facility. The purpose of this exercise is to have close monitoring of your well-being so as to safeguard your health and particularly safeguard that of your family and your friends at large.